Thank you, Joseph, for being here. Joseph is part of our sales. All right, let's go ahead and start. Are you ready, Dr. Okan? Okay, well, let me introduce Dr. Okan Antia. He is a doctor of physical therapy. He is the owner and founder of Campus Motion Physical Therapy and also Sports Recovery. And you are located in Cypress, Texas. Yes, I really do appreciate you taking your time to spend with us and just to break the ice. So let me break the ice and, tell everyone that we actually met. We actually saw each other during the cryotherapy convention in Plano, Texas. Was that your first?
Yep, sure was.
Is that something that you would, and it was very interesting. Would you do it again next year?
Absolutely. Absolutely. I actually added a few services that I learned about there. I guess we'll talk about later, but yeah, it was a great experience. And, yeah, if you're in the health and wellness cryotherapy world, good conference to meet a lot of vendors and get to network with a lot of fellow like-minded health and wellness.
I've never seen that much cry chambers and actually Florian there. I'm enjoying that convention and I met Next Level and other providers of cryotherapy. So that was a great experience, and I'll be there next year. So I will see you for sure. It's gonna be I know it's gonna be fun. So yes, Dr. Opon, what is what made you incorporate cryotherapy?
So for me, as a sports physical therapist, I've been a physical therapist for about 15 years, and I started my own practice about almost 4 years. And so for the first 3 years or so of my practice, I just did mainly physical therapy and, saw the range of orthopedic and sports patients for knees, backs, shoulders, etc. And I decided to expand, add a new office and expand my offerings. And when I added the new office, I decided that if I was going to go through with opening a new office, I wanted to be able to offer a more holistic health and wellness experience beyond just physical therapy. When you're a physical therapist, you tend to only get to work with people after they're already hurt or injured, kind of down in the dumps to and not necessarily able to do the things that sort that's happened and now they can't work out. So it's usually something that process. What I wanted to be able to was work with folks on the front end and try to prevent some things from happening and keep people well from ever getting hurt to begin with. And so I started brainstorming different strategies, different offerings that I could add that would either supplement my work as a physical therapist or actually serve on prevention and wellness side. So a lot of the services that we're going to talk about today, including cryotherapy, are things that we can use for our physical therapy patients, but also folks that aren't injured. They just want to stay well and maintain the performance or improve the performance that they have in whatever sport or activity that they are making. So that's how I came across offering cryotherapy as one of the services that we have. And so far, so good.
Good. And then I know you had the whole body cryotherapy and you had the targeted cryotherapy. When did you started using the America Cryo targeted cryotherapy?
So I actually received my Sub-Zero cryotherapy device in May of 2022. It was actually the first wellness device that we had purchased. And one of the reasons why I wanted to add localized cryotherapy to our practice is a lot of the effects that localized targeted cryotherapy have, they worked they work in conjunction nicely with our traditional PT rehab services. So the localized cryotherapy helps a lot with, sprains, strains, tendonitis, things like that. And so those are common conditions that we see as orthopedic and sports physical therapists. And so being able to have something that can help with the symptoms immediately while we also work on the dysfunctions and the deficits that caused those tendinopathies and those different injuries, inflammation, etc. So have something that could help with the symptoms immediately, but also help push the rehab process along for somebody post-injury, made it a perfect adjunct to add to a growing PT practice. And so that's kind of how we are able to use the targeted cryotherapy currently, is in acute injury situations where we need to get inflammation down, we need to get swelling down, we need to get some healing stimulated in tendons and ligaments. That's where the Subgro device comes in handy to help. And then from a PT perspective, we're evaluating, strength and mobility and different things that probably caused the injury, while also giving them immediate relief. And so we found that conjunction has helped. Those two things in conjunction have helped us get athletes back on the court, back in the game, back on the field, back to running quicker than just our PT services.
Being a lot of great stuff out there. So you already mentioned all the benefits, a lot of benefits of cryotherapy, but just for educational purposes, there's a lot of people who doesn't know about cryotherapy and all the power of cryotherapy. Can you please, in your words and perspective, what is cryotherapy and how does it work?
Oh, long story short, with cryotherapy, a thermal shock fighter cryotherapy device is that it activates the blood and nutrients and oxygen, everything that helps tissues heal comes rushing to the area because the body feels like there's something be going wrong at the area, but it's just activating all the healing factors to come rushing in. And so from a localized cryotherapy perspective, if you were targeting a specific area, usually tendons and ligaments, the reason why they take so long to heal is they have poor blood supply. Sprained an ankle or has had Achilles tendonitis or plantar fasciitis, IT band tendon, anything like that, you know that those things heal pretty slowly. And it's because tendons and ligaments don't have good blood supply, which one with the cryotherapy device, you're trying to speed up the body's natural healing process. Won't happen as fast as we would like. And so cryotherapy gives us that boost to get that area to heal faster. And so in an acute injury, it helps us, is already trying to heal it, and everything is rushing to the area. And so we can speed that up and make that happen even faster. On a longer term tendinopathy, sometimes the healing process has gotten stuck. And so it's not really in the process of healing anymore. The body's considered it healed, but it's still painful. So sometimes you have to just start that healing process, and using the cryotherapy, rushing the blood and nutrients and oxygen to the area, restarts the healing process and gets it healed properly, while we go through our rehabilitation process to help remodel the tissues and the way that along the stresses that they're going to be used for. So now we're helping that ankle sprain get used to sprinting and changing directions and jumping and all the different stresses that it has to do versus if it's just in a static position in a boot
Yeah.
at rest, it's not used to those stresses. So that's how we use it in conjunction with the rehab process.
So is there any precaution or considerations that people need to consider before doing cryotherapy?
Yes. So for localized targeted cryotherapy, we just want to make sure that the area is clean and dry because of how cold it gets. We're dropping the temperature uh, down towards 32 degrees. And so we want it to be dry. We don't want any lotions or liquids or oils or anything in the area that might cause it to freeze. For whole body cryotherapy, blood pressure is one big, your body's response to super cold temperatures. If you have high blood pressure, it's indicated for you to do whole body cryotherapy just because it's going to raise your blood pressure, and you don't want your blood pressure to rise into a zone that causes other issues. We want to make sure that we are safe, and so we take all precautions when it comes to blood pressure with whole body cryotherapy, as well as make sure that skin is clean and dry. With whole body cryotherapy, we do have to wear gloves, we wear tube socks, and we wear snow boots to protect our extremities, protect our fingers and toes. And so those are mandatory for whole body cryotherapy. As far as clothing on localized cryotherapy, you just need to have the area that you're treating exposed. And as long as it's exposed and clean and dry, then we're ready to roll.
Yeah, yes, that's the beauty of the targeted cryotherapy. It's so convenient, it's very easy. So you mentioned about the whole body cryotherapy that you have. What other modalities do you have? Do you offer the services in your clinic?
So in addition to the whole body cryotherapy and targeted localized cryotherapy, we also have whole body red light therapy. We have compression therapy. We also do resting metabolic rate and VO2 max testing. We also have 3D functional performance testing, 3D running gait analysis. We do 3D concussion balance analysis. And we also do 3D weightlifting and exercise. We're recording on a 3D camera for all those different analyses. We're recording on a 3D camera where we able to break down how the spine, the hips, the knees, the ankles, how everything moves, and able to detect deficits and dysfunctions and movement patterns that will lead to an injury in the future if it hasn't already happened. And so we're able to detect those things on the front end. The dirty little secret is, as a physical therapist, a lot of the injuries and things that we see, rehab process and the exercises that we issue, a lot of those we're able to detect a dysfunction that might lead to an injury. And so we can give those exercises on the front end, and we call those, before you get hurt, we call those exercises corrective exercises. After you get hurt, we call them rehabilitation exercises. But a lot of times there's a lot of overlap, and those dysfunctions that turn into an injury, a lot of times those are present before you get hurt. So those screen analyses give us an opportunity to identify that. As far as the VO2 max and the resting metabolic rate, we're checking your fat burning efficiency, burning carbs or fats, how much you're burning, what percentage you are burning of each. If you're trying to lose weight, We can figure out exactly how many calories you burn in a given day. So when you do your workouts, you can figure out the exact number of calories that you're burning that day. And if you're trying to gain weight, what you need plus weight, which you need in deficit. Uh, we can also measure your lung and heart fitness, and then your breathing cognition, all through breathing into our all through the breath analysis through our mask. And so VO2 max helps a lot with folks who are training for marathons, triathlons, a lot of athletes, and for our longevity services. So if you're trying to figure out a way to live a longer, healthier life, VO2 max is the gold standard test to determine how long you live. We're able to analyze that as well with our VO2 max test, also through our breath analysis.
Wow, that is a game changer. I saw one of your video on your story of your Instagram, and I saw that metabolic testing, and I was like, I need to try. And because one of the patient, she was like running on a treadmill, and was that the breathalyzer that you were mentioning?
Yeah. So that she was so on the treadmill, she was doing the VO2 max test. So on the VO2 max, we could either do it on the treadmill, or we can do it on the, just depending on what which one you do in your training. So people that are cyclists, we can have them do the VO2 max test on a bike. And then folks that are runners, we have them do it on the treadmill. It's on that whichever fitness activity that you're wanting to improve, if we test that specific one, we'll get more accurate numbers, because your VO2 max may be different running versus cycling. If you're a cyclist, we want to get you on the bike. If you're a runner, we get you on the treadmill. But yeah, the VO2 max helps us with performance. It helps us set your trainings up. And then the combination of tests will tell us if resistance training, interval training, or cardio are the specific training apparatus that you need to do at any given time. So everyone has a specific amount of exercise in resistance and cardio and interval. And so those tests help us identify what works specific. And so our report will say, you need to do this much cardio, this much interval, this much strength, tell that more specifically. And so it's a good for anybody that's trying to be healthy, trying to live a long life. If you're getting into an exercise program, front end, you're starting, you're worried about, are you going to get hurt, and how to safely begin. A lot of these tests give us a chance to make sure that you're not going to injure yourself with our 3D screenings. It will tell us what exactly you should be doing from an exercise perspective day to day, whether you're doing strength or interval.
And everything is there. You have the preventive, you have the recovery, and with the cryotherapy, and it's like, what else do they need? You offer everything. So, and it's amazing that you incorporated cryotherapy with this other modalities that actually congruent to one another. They can work side by side. So
well, and so the things that cryotherapy helps with on the whole body cryotherapy side is if we identify that your fat burning efficiency is sluggish, whole body cryotherapy, because it speeds up your metabolism,
yes,
it can help. So for the same reasons why localized targeted cryotherapy are used for slimming, whole body from the inside will help you burn fat faster. So one, identify if you have a deficiency in your fat burning efficiency for of your same age and demographic, whole body cryotherapy and body light therapy can both help you burn fat faster. So if somebody's looking for ways to lose or burn fat and you're kind of stuck, cryotherapy is a good way to get unstuck.
Yes, yes. Combination of that cryo chamber, the whole body cryotherapy, and the targeted cryotherapy, sub-zero together. Like you said, when our body is exposed to that extreme, cold temperature, it actually contracts our muscles, and that will, help with the metabolic, increase our metabolic process. So that leads to burning more calories. So that is interesting that you have that both. That's my goal. I want to have that later on in my clinic. So it's nice to see that it can work side by side. So I know that you are featured. I saw you're featured on USA Today. That was amazing. You had a interview, and it's about discovering cryotherapy as safe alternative for pain management and stress relief. So can you share us what was that experience?
Yeah, so they reached out. I guess they, doing a kind of they decided they wanted to run a story on. So reached out after looking for a provider of cryotherapy, and so just I kind of answered the call, and they proposed a few different topics as it relates to cryotherapy, and so I decided to roll with that particular topic, and yeah, and basically we're talking about how it helps with pain management, which we discussed earlier, but also how it helps with stress management and relaxation. And so when you are dealing with stress from day to day, cryotherapy, because of the endorphin release for the 2 to 3 minutes that you're in there, the body relax, and that relaxation and mental clarity can help decrease anxiety symptoms. And so we've seen that in our office where folks are, having stress or there's a lot going on. And so Get Chamber gives a chance to do all the recovery and physical health and wellness stuff, but it also helps with the mental relaxation and stress. So a lot of that article, some of those factors, kind of some of the stuff that we've seen.
Yes, then I read that on that article, it says an effective pain management can be termed as pandemic. And what do you say about that?
Excuse me. What?
In that article, it says an effective pain management can be termed as pandemic because I agree on that article because it says that if as for people who was going through pain and they live with that, there's like a significant reduction in quality of life. And with all the patients that you experience with going through chronic pain, I mean, for me, a lot of people are in pain. Do you agree?
Correct. And it's a non-pharmacological pain reliever. And so you're trying to stay off of long-term opioid usage, trying to stay off pain medicine, long-term anti-inflammatory medication. Cryotherapy gives us a safe alternative to that. And so folks that have chronic pain, maybe you've got something that considered permanent or chronic, and cryotherapy can be used in the management of that on an ongoing basis. So a lot of our cryotherapy services are offered through memberships and packages on an ongoing basis. And so whereas as a physical therapist, when we're seeing you as a patient, there's usually a start and end to your plan of care. Cryotherapy is something that's incorporated on an ongoing basis.
What can you say physical therapy, or do you recommend incorporating, like you did, incorporating cryotherapy, even sub-zero cryotherapy for now, and later on the cryo whole body cryotherapy to every physical therapy clinic or even chiropractor?
So the way I look at it, I guess that translates more to everyday physical therapy or chiropractic practice would be the sub-zero localized cryotherapy, because we use it for sprains and strains, neuropathies. It also helps with muscle spasms. So a lot of times when people come in and with acute muscle spasms, we're able to use the targeted cryotherapy to get the muscle spasms to last. And so most conditions that we deal with on a day-to-day basis in sports medicine. And so, you know, ice baths have been a large part of sports medicine wellness practice. And so cryotherapy just kind of takes the cold pack, the ice bath, and kind of ramps it up to another level. And so, whether it's tennis elbow or chronic ankle sprains, chronic tendonitis, chronic knee tendonitis, all of those conditions respond really well to localized targeted cryotherapy, while also addressing whatever dysfunctions caused that issue to begin with. And so if it's a ankle sprain, then obviously there's not necessarily a long-term process that led to the ankle sprain, but usually if there's a tendinopathy or knee tendinopathy, there's something going on along your that is leading you to have that. And so by addressing that through our process, will also open immediately kind of gives us a comprehensive approach to some of those chronic conditions. I do recommend that the chiropractic practice add service. It's good for the patients that and it also broadens your scope, be able to bring in other types of classes that you may not have seen on the post-injury side, people that are just wanting to stay well. Some folks that are to go stretch and flexibility coach, some of those folks, they're looking for some help and some relief, but they're not necessarily thinking that they need to go down the path of seeing a doctor as our chiropractor. So offering that service, you can door to that population of folks that may not necessarily come see you on medical side and really good. It's been a really good.
Yes. And I completely agree with you. There's a lot of, I see clients who come here either before their physical therapy appointment or before their chiropractor appointment, just to get the muscle relaxed before an adjustment, for example. And then they come back, the next day, and then they're like, okay, I need some cryotherapy because they feel some soreness after chiropractor adjustments. So I feel like it goes hand in hand, just like what you do at your clinic, that, two modalities working together. And yeah, I completely agree. So what are your future goals for your clinic, for the practice that you have? Are you trying to expand? What are the other modalities that you're planning?
So right now, we just added the performance testing and the 3D performance testing. And so now we just launched that summer. And so we're incorporating into our traditional workflows, and then getting the word out about how those services complement our physical therapy offerings and then our wellness and sports recovery offerings. And so the idea is to have a one-stop shop for physical health and wellness, and also help out the mental health and wellness journey that folks are going through as well. And so we also have added the Brain Tap headset, which I know you have as well.
Yeah.
And so we want to definitely pay attention to our mindset and mindfulness and incorporate some meditation and stress relief from that aspect. And so trying to make it so that folks can live their best life and compete in the sports that they want to compete in, train the way that they want to train, and, hopefully stay injury free. And so, if my whole practice turned into prevention, health, and wellness, and I barely saw physical therapy clients, that would be fine with me, because that means that we're keeping everybody healthy and well. And, we can see you after injury, but a lot of stuff that we're seeing people for could be prevented on the front end. And so we want to push that narrative if possible, that we can prevent some of this stuff. We've got a lot of youth athletes that are playing year-round sports. They're doing volleyball, they're doing baseball, they're doing basketball. And so there's all these sports, and then you're playing for school and you're paying club or select you. And so there's a lot of wear and tear. And so these things are turning into hamstring pulls and calf pulls and low back pain and stuff like that in our youth. And so everything that we have here is an effort to help reduce and prevent some of that stuff from happening. Obviously, if somebody crashes your knee or you fall on your shoulder, you're going to hurt. That kind of is what it is. But a lot of these non-contact, non-acute injuries where you're just doing something and then you start to feel a muscle tighten up on you or pull on you or strain on you, those things are all preventable. And so there's different ways that we can identify if you're at risk for that. And there's different ways that we can keep you well so that that stuff doesn't happen. And so just using my platform to educate folks that you don't have to wait until you have to sit out or that you can't play to do stuff. Like, you should be maintaining your body and maintaining your performance in real time. And, everybody wants to, if they're in middle school, they want to play high school sports. And if they're in high school, they want to play college sports. And if you're in college, you want to play professional sports. And what people don't realize is those guys spend millions of dollars on taking care of their body so that they can go out and perform. And so the folks that you see on TV competing in sports, they have folks like me working with them every day to make sure that they go out there and perform their best. And so it's getting that message to the masses and to the community that these are things that you can do in real time to make sure that you don't have to sit out. You don't have to sit out 4 weeks or 5 weeks or 6 weeks. If you start having aches and pains, if you feel like you're having to foam roll the same muscles over and over and over, chances are there's a dysfunction or a deficit there that's causing you to have to do that. And so you can keep doing your foam rolling, but let's identify why the right calf always has to be foam rolled, or why the left hamstring always has to be foam rolled, because chances are there's a possibility that that's going to turn into some type of injury. Let's identify those things on the front end, and you never have to get out, you never have to break. So that's kind of what we're focused on, getting that word out.
Yes, and I saw that you actually participated in a community, and that's a good thing because you're, like you said, you're bringing it out there and showing it to educating people in your community that before you don't have to live in pain, and before you get hurt, just actually all of these, in that for recovery as well. It's amazing how not a lot of people know these that they can use for prevention and also for recovery. So Are you doing a lot more of that events later on?
Yes, so we're we've got a few health fairs coming up. We've just performed some health fairs. We set up at had a few vendor booths. A couple weeks ago, I did a seminar for a local running club where we talked. Got another vendor fair coming up in September. Another health fair, another couple health fairs, and so yeah, this is the message that we're trying to get out. Yes, my background is as a sports physical therapist, and if you hurt, you act, whatever, we can help you get better from that and get you back on the court, back on the field. But it's way cheaper
Yes.
and way more fun to prevent it from happening. So prevention and recovery is a lot less expensive than physical therapy and rehab and doctor's appointments and MRIs. And so the stuff is here to help prevent all of that. If you want to see us after all that stuff happened, you're more than welcome to, but I'd recommend you save some money and do some of this stuff on the front end.
Prevention is always better than cure. Yeah, that's a very corny, but it's so true. That, it's better to do all these before you actually get injured. Because like you said, physical therapy is expensive and not everyone can afford that. So they decide to just live through pain and chronic pain. And yeah, we don't deserve to live a life, in pain. So
And when you're working with a lot of high school athletes like I do, if somebody suffering injury in high school sports, you only have 4 years to play in high school. And
yes,
so if you miss an entire year or the majority of one season, now I got 3 years in high school, and let's say you play on the freshman team and then you got on junior varsity. Maybe you got play varsity as a junior and a senior, or maybe you just play varsity as a senior. You don't want those 1 or 2 years to be affected by injuries that are preventable. And so, I want parents to consider that when they're taking their athletes to all these uh, different events and club sports. You don't want your athlete to be sitting from all the sports that they're playing. And so the best way to prevent that from happening is to focus on the recovery in between and to identify if there are any deficits that would lead to an injury. Nobody wants to see an ACL injury or an Achilles injury. And a lot of times, the most severe injuries that we see are ones where nobody even touched you. It's just how it happens on your own. And usually if you have an injury where you weren't, chances are it was preventable and the factors that caused that injury were present well before you actually got hurt. And so we can identify from jumping and landing mechanics and how your knees and hips move when you squat, when you jump, when you land from a jump. We can identify if you're at risk for some of those things and address those before they become a major issue. We know that we're spending a lot of money and a lot of time and energy on club sports and high school sports. So my message is to focus on the prevention and recovery side as well, because you can't enjoy the fruits of all those activities if you have to sit out, or if you're playing, but you're playing at 50 or 60% of your, so you want to play and you want to play at your best and give your effort. And so we're here to help guide. And so everything that we offer is in service of keeping all of our athletes, our marathoners, our triathletes on the field, on the court.
and that's good. So where can all your future clients find you, your social media, your address, and they book an appointment with you?
So our website is www.camping.org. You can find me on Instagram at the dot cryo dot recovery dot physio, or at campus underscore motion. So that's so those two handles on Instagram. On Facebook, you can find us at Facebook/campusmotion.org.
I think that up for you. I put that on the message and it's going to be on Facebook as well. Thank you so much, Dr. Okwan. We really do, on behalf of America Cryo and all of us watching over here, we do appreciate you taking your time. I know you're so busy, you're seeing clients too. So we're both running clinics. So taking time and doing this for us means a lot. And you have so much knowledge. And we do appreciate you sharing all of that. And we are so proud of you for being featured in USA Today about cryotherapy. And I know that we're going to see each other again. I'll be there on the cryo convention for next year in March, same hotel, same city. So I will see you there. And we'll probably do something like this, maybe in person. What do you say?
Sounds good.
Yeah. Yes. I love doing this because there's a lot of education that the attendees or the special guests that we have shared to a lot of people about cryotherapy. And now a lot of people knows about cryotherapy. And you out there in Cypress, Texas, doing all this preventive and recovery and all these modalities that you have that you offer to the community and help all these athletes and, high school students and sports person. It's amazing how you do all of this together.
Well, thanks for having me, and I look forward to.
Yes, thank you. And for everyone who tuning in, thank you so much. And we will see you for another Breaking the Ice next week here on America Cryo. And we'll see you. Thank you so much. Have a good night.